Okay, so I welcome all of you for this session, and I also acknowledge our whole coordinator, and I welcome the moderator of the session, Dr. Anju Jethani and Dr. Bipin Jethani. So I request Dr. Anju Jethani and Dr. Bipin Jethani to please take over the session and invite the chairpersons. Over to you, sir.
Thank you, Surabhi. Thank you. So, on behalf of LMHI, I extend a very warm welcome to our respected chair, to dignitaries, colleagues, and friends across the globe to this scientific session of LMHI Global Colloquium 2021, in which we would be discussing on the theme of epidemic and pandemic experiences of long and acute COVID. Before I go on to elaborate upon the theme of the seminar and give a brief overview, a synopsis of what we're going to expect in the coming session, I would take this opportunity to first welcome our chairpersons. In this particular session, our chairperson is Dr. Todd A. Hoover. Dr. Todd A. Hoover is an integrative medical physician who has served as the National Vice President of LMHI for US chapter. He is Secretary of Homeopathic Pharmacopoeia of United States, HPCUS. He is a well-known author, and he is revered for his writings as well as for his skills. He is also the president and founder of Better Medicine, which is social hosted network of alternative medicine. Sir, it's a pleasure to have you with us, and we look forward to a great learning experience with you in this coming session. A warm welcome, sir.
Thank you, and thanks for LMHI. The Congress has been wonderful so far, and hopefully we'll have some good talks this session. It's an honor to be here.
Thank you, sir. Thanks a lot. Our second dignitary, esteemed guest of the session as the chairperson for the session is none other the Indian face, the well-known Indian face on international platform, Dr. Alok Parikh. Dr. Alok Parikh needs no introduction. He is the first Asian in 4 decades to be world president of LMHI, this league which is known to promote the best interest in homeopathy. Dr. Alok Parikh is chairman of Ayush Advisory Committee, Government of Uttar Pradesh, and CCRH, which is Central Council for Research in Homeopathy, Government of India. He is also the senior most faculty member of postgraduate homeopathic courses in University of Agra. Sir, it is an honor that you have been awarded Yash Bharti by Government of Uttar Pradesh. And we always look forward to your guidance and to your illumination in any scientific session. We welcome you on board, sir. A very warm welcome.
Thank you very much, and it's with great pleasure, and I feel honored to be here as a chair in this very important session, and look forward to some very informative talks.
Thanks a lot, sir. Thanks a lot. And we also look forward to be part of your experiences on the global platform. Thanks a lot, sir. Thank you. The session, as I said, is about the experiences of long and acute COVID. We all know that COVID has challenged our healthcare system for 2 primary reasons. One, it has been a novel disease with very limited information with regards to its clinical manifestation when it first began. And secondly, from therapeutic point of view, from intervention point of view, there were very limited drugs which were available for the treatment of COVID-19. This led to the various researchers, specifically in the field of conventional medicine, but more so also in homeopathy, for the search of alternative therapeutic agents in the form of repurposed drugs. As they say, with every difficult time also comes, with every challenge, with every difficult time also comes the opportunity. And we as homeopathic physicians are proud to say that we did take this opportunity to refine our research skills, data curating, and data analytics. We have today with us in this session 7 learned speakers who have worked through the researches of COVID and have done a great job in ensuring that homeopathy as a system gets its root in the research methodology for the treatment of COVID. To begin with this session, I will first of all call upon Dr. Chandrasekhar Gowda, who will be talking about the role of grassroots community health worker training in managing COVID-like illness in tribal community. Sir, I welcome you and hand over the system for you for your presentation.
Thank you very much. I'll share my screen.
Yes, sir.
Is my screen visible, sir?
Yes, sir. Yes.
Yeah. Welcome you all, distinguished chairpersons. COVID-19 has been troubling us for the last 2 years, and it has promised to trouble us for some more time. So I would like to share this experience from a different angle, that how training of grassroots workers at a tribal grassroots level helps in managing COVID-like illness in the tribal area. The plan of the presentation would be is first, we will give you an idea of what was the COVID-19 like situation in the community, and then how was the organization prepared to handle the situation, the actual handling of the situation, and then the results and the learning from the handling. So if you see, in the months of April, May, and early June 2021, there was a sudden wave which affected most of the hamlets in the tribal area of the Vikramgarh block of Palghar district in Maharashtra state. The way in which it affected was very different than the earlier ones, because that the tribals were getting knocked out. Earlier with fever-like illnesses, their tribals still work, but here they were just not able to get out of their houses. The symptoms of fever, cough, and breathlessness and sudden collapse was seen. We were witnessing deaths at a very rapid rate. In one example of in a village, we had almost 4 deaths in a span of a week. But the challenge was that none of them were ready to get themselves tested, and we could not definitely confirm at the beginning of the illness. And this was one of the challenges which we were facing. The community behavior was also very peculiar. Just as in every area, fear, panic was there, but the intensity of the fear and the panic in this area was such that they were refusing to get tested, they were refusing to get treated. In fact, if any government camps were being organized, they would run away and hide in the villages or in the fields or in the jungles. So this was the type of situation. They used to threaten the health workers, saying that if you report about us of having fever, we will beat you up on. This was the type of situations. The sarpanchs were also being threatened of not reporting any of these cases. So this was the situations which we faced from where we were we had to handle this problem. The situation of health workers, we have been working here for the last 25 years and we have trained about 48 health workers for 25 villages. Even the health workers were surprised at the response of the community. They were also, the government health workers were already afraid. Many of them ran away from the villages and hid themselves in different villages. Our health workers who were MLDT trained, they had a slightly different situation in the sense that they were all vaccinated. Many of them were on constitutional homeopathic treatment, and interestingly, they or their family members did not get affected by this illness. This they tried to share with the villagers, saying that how the vaccinations helped them and all that. So the response of the villagers were that you are a government health worker and you are MLDT worker, so you have been given a good vaccine, whereas we will be given water for injection, so we don't want to take this vaccine. That was the type of response that the community was giving. So these community health workers remained in the village, which showed their commitment. So that was one of their attitudes which they developed because of the training. So now we were faced with a situation where physicians could not approach because government could not approach, the health workers could not approach on a door-to-door basis. And we also noticed that the nature of the illness was, it was very quickly spreading, at the same time rapidly deteriorating the patient's health. So a tubercular miasm was what we were identifying, but what could we do? We cannot keep quiet since deaths were occurring. So what is the role of a homeopathic physician in such an area? So this is the, what options do we have? The resource position of the organization, which was working for the last 25-30 years, is that we had trained physicians, we had homeopathy and manpower, and mainly we had community health workers who have been trained over a period of time on the concepts of action learning. They used to be given small task-based trainings. They would go into the field, do tasks, come back, again further develop on them, give them problems for which they will solve. And they have been using this in earlier epidemics like conjunctivitis, diarrhea, mumps, and measles. They were able to do case taking and then arrive at these things. So they have been able to prove some level of competence in handling such things. So they were also handling acute illnesses on a regular basis, which is very important. So hence, we were sure of collecting reliable data from them, and they were a bridge between us and the community. Now, this whole thing was planned on a day in a 4-hour period because it was such a war-like situation. The illness was spreading. We had to come up with a quick solution. So we tried to collect all the data as no one was being allowed to visit their houses. We tried to collect the data on phone, smartphones. The patients, the CHVs were calling the patients who were cooperative and getting data from them. They were given a list of data, list of symptoms. So this was one of the tasks which they had to perform. So they took up this list, kept on calling the patients and started collecting data. So now the number of households which we collected were almost 672 households which had this COVID-like illness. The list of symptoms which we gave were the generals, fever, joint pain, body ache, this thing, COVID-specific loss of smell and loss of taste, and the system-based coryza, breathlessness, GIT, and others. From this, the process of analysis took us about 2 hours to get the data on phone from 35 patients. We analyzed this data based on Boning-Wasson's approach, location, sensation, modality, concomitant. This is, as you see, this is how the data got collected. The guiding principles which allow us to analyze the Hahnemann guidelines were from the individual to community, how do we extend? Community susceptibility, community totality, and individualization. These were the principles which we are stuck to because we found that in the earlier pandemic, the common medicines which were used for prescribing were not so effective. So we had to individualize and find out what were the specific remedies coming for this particular epidemic or pandemic. So after analysis, we came to 3 remedies which were arsenic, pulsatilla, and gelsemium. So now again, we had a short window. So we trained the health workers on phone, gave them one-liner differentiations, weakness and thirst, increased arsenic, thirst decreased headache, pulsatilla, thirst decreased sleepiness, gelsemium. So these one-liners helped them to differentiate. So they were also based on these type of symptoms and the intensity, we arrived at a potency based on the susceptibility which was there. And they were clearly instructed that they were to treat for 1 or 2 days. And if there is no response, they were to come back with a follow-up. So the whole thing commenced after a 4-hour period of the thing. And from the same day, the treatments were started. The whole treatment period was for 2 to 3 weeks when about 350 patients were treated. We could record about 265 of these cases on Google Sheets and analyze them. So what was the results which we could get? These are the records which the CHEs were keeping. Like, for example, this CHV treated 3 cases prescribed with pulsatilla and 1 case with gelsemium. So this was an important aspect of them keeping records as well, which was very significant. Like this CHV was keeping 2 cases on arsenical and 1 case of pulsatilla. So all these allowed us to document the process of training, the process of the update which was occurring. So at the end, we found the improvement in about 93% of cases. One important factor which allowed us this sort of a result is that we had identified it fairly early and responded very quickly. So this was significant, and very interestingly, the CHVs were able to use their differentiation methods to try and give medicines. If they were not improving, they would change into second medicine. So this training was very significant in how it was helpful and effective in managing this. So this was the percentage of arsenic, pulsatilla, and gelsemium, 40% with arsenic, 40% with pulsatilla, and gelsemium was about 20%. So if we compare it with what we used to manage, so arsenic did come up as a significant remedy in managing these illnesses, but at the same time, because of individualization, we saw that pulsatilla and gelsemium also came up, and that helped us to see the genus epidemicus, which is not 1, but 2 or 3 remedies which are coming up. This is the percentage of patients who are better within 2-3 days, within a week. So at the end, what do we realize with this experience which was done in the field? And mind you, the challenge was such that we were not allowed to directly go and talk to the patients. It was all on phone. And because of all the training, which over a period of time allowed the CHVs to collect meaningful data, try to sort them out, and then at the center we did. So a process of action learning. The methodology was action learning. You act on a certain template, come back with the results, again review and act. So we could derive a methodology which we had applied to treat a pandemic in the community. Advantage of treating illnesses without diagnosis. Mind you, we could not diagnose many of them because they were not ready to get diagnosed. But later on, some of them got diagnosed. So those who were treated, they turned out to be positive, and we knew that, yes, we did treat febrile illness, which was possibly COVID. It is possible to treat acute illnesses of this nature on a mass scale with the help of our barefoot doctors. The amount of training we will invest in these barefoot doctors will proportionately give us the results. The model is based on grassroots training of grassroots workers. Team working is important. We as a physician team and as an organization, we kept on working as a team, networking with the villagers, networking with the leaders of the villagers, the community sarpanches was also important. And finally, we did realize that homeopathy can be integrated for community medicine, and a pandemic of such a stature and which was so rapidly progressing was able to be controlled. The beauty of this was once the results started coming in, the community gained confidence, and then they started mouth-to-mouth publicity, and the villagers started flocking the CHVs as if they were doctors. So there used to be a queue of people wanting to get medicines from the CHVs. So we were happy that, and even these health workers were so happy that finally they have been recognized as barefoot doctors. And they were happy when the people were feeling relief, and the confidence in the people grew. And its effect was recently seen when many of these villages people came forward for taking vaccinations. So now we have been able to extend this faith to the extent that now we are able to prevent. So a lot of the villagers have taken vaccines. MLDT has now been actively working on vaccines, and we are going interior and giving vaccines. So I'm happy to share that this is the level at which we have been able to reach. Thank you very much for giving me this opportunity. So Liga organizers, MLD LMHI faculty, and the tribal health secretary. Thank you, sirs.
Thank you, sir. Thank you. It was actually a very enlightening session, more so because you were able to take homeopathy to the grassroots workers, which itself, logistically speaking, is not an easy thing to do and not an easy thing to manage. Thanks a lot for very, very illuminating lecture, sir. Thanks a lot. I don't see any questions in the question answer box. I'll request chairpersons to kindly give their valuable suggestions regarding this presentation.
Okay, Dr. Hoover. Thank you for this such a informative talk by Dr. Gowda from Dr. Dhavle Center in Maharashtra. The first and the best thing is that they work with very poor people, and they work in the rural areas and also with the tribals. So they work with the spirit of homeopathy. And you see, homeopathy is not only medicine, but it works with nature, and it works with sympathy and harmony. So I must congratulate them, and they have been working for a very long time.
30 years almost.
Yeah. And in difficult situations, and with very little budget, you call, and very different and simple situations. So they, of course, they give homeopathic doses, but they give a lot of love. Now, coming to this pandemic, they have shown us a way. They have shown us a way to identify and respond promptly. It is said that homeopathy does not wait for the new remedy to come. We already have a big armamentarium of homeopathic remedies in our Medica for all future viral infections to come.
Yes.
No matter which strain comes, we are always prepared. And this is what they showed. They went to the villagers through the health workers. They got some quick snapshot symptoms, and they could find the common remedies, and they worked. They got the result. So thank you very much, Dr. Gowda. And this is what is the spirit of homeopathy in epidemics, pandemics, and for any problem to come. Thank you very much.
Thank you, sir. And we do have analysis by Google Forms. It's a beautiful tool, and we could get wonderful analysis on which we could base all these things. Thank you so much, sir.
I just had one comment. It was a lovely talk, and appreciate the good work that you're doing. My question was, these barefoot doctors that you're using, were they from the villager population itself, or?
Exactly. So they were 7th standard lady, 7th standard educated housewives of the village. So they were from the village itself. They were.
And that probably increased your compliance dramatically, I would assume.
Yes, sir. Yes, sir. That's right. Very true. That's a very nice point. So they were identified by the villagers themselves because acceptance of them was very important in them as a health worker. So that was something which we always worked on.
Perfect. Perfect. Thank you.
Thank you, sir. Thanks for your enlightening comments. I'll now hand over the system to my co-moderator, Dr. Anju Jethani.
Yeah, thank you, Dr. Vipin. I would like to invite Dr. Yogesh Sehgal, who is the torchbearer of Sehgal School of Revolutionized Homeopathy and a well-known homeopathic consultant. The title of his presentation is Experiences with Sehgal Method During COVID-19 Pandemic. Over to you, sir.
Thank you so much for having me here at the Liga Colloquy in 2021. So let me share my screen, and is it visible now?
Yes, sir. Yes, sir.
Thank you very much. So first of all, I would like to pay my gratitude toward all scientists, medical staff from all fields, health workers, voluntary helpers, administrative workers, police department, and all institutes who have worked and still working tirelessly to help the people at the time of COVID. The topic of the day is importance of understanding the mental state of the patient and clinical applicability of mind rubrics with special reference to the COVID pandemic by Sehgal method. In the beginning of the pandemic, I was getting calls from all those patients who were already under my treatment and from known people around me to inquire if in homeopathy there is any preventive medicine for COVID. Firstly, I was just telling them to maintain appropriate COVID norms as per the government, and in case they suffer from COVID-like symptoms, then they can contact me. As more people started getting affected by COVID all over the world, that had created panic amongst the people that they started using whatever means they came to know from the social media in order to prevent themselves from getting COVID. After 1 month, the demand for preventive medicine increased, and I was approached by people to give homeopathic medicine as a preventive. From May 2020 till this paper was presented at my clinic in New Delhi, I have treated approximately 352 patients suffering from mild to moderate severe category of COVID symptoms. They were taking the standard treatment advocated by the government agencies related to prevention and management of the disease, but could not recover fully. They only had little symptomatic relief and hence approached my clinic for homeopathic help. After 1 month, the demand for preventive medicine increased, and I was approached by people to give homeopathic medicine as a preventive. According to the present situation that time, people started to be more cautious, careful, and the situations like lockdown, quarantine, which were new for everyone, increase in number of cases, restrictions related to traveling or outing, compulsory wearing mask, panic state due to disease itself, and those who already got affected by corona. I started to prepare myself and selected a few key mind rubrics, keeping in mind the above situation. Let me be clear that the presentation I'm going to show you about the rubrics and the remedies was already prescribed me for the last 30 years for different diseases also, not only for the. So what I did, first I say that, okay, there is a huge demand for preventive medicine from all over the world for every homeopath. The people were calling them, give preventive medicine. So what is the state of mind for those people who are asking for preventive medicine? Do we need to take a case? Yes. The first rubric which came to my mind was escape attempts to. That was the thing that people want to escape from getting into the corona. So for me, this is the exact and good rubric for those who want preventive medicine. Cautious, anxious. This was my second choice. Of course, the people are very cautious and anxiously cautious. They are too much worried that they will get corona, and they are running around having everything, whatever possible they want. They could have kala, whatever you give them to drink, they will drink. So I clubbed these two rubrics and I got 5 remedies: Baraitacar, Causticum, Lycopodium, Pulsatilla, and some. These are the only 5 remedies common in 2 rubrics. So you could say that, okay, according to the nature of the patient, more behavior, I could ask 1 line and I could give 1 remedy out of. Okay. Next, the most prevailing mental issues were restricted at home, which was completely new for the people. Loss of business, fear of quarantine, living alone in a room for 14 days, death thoughts, agitation, nervousness, fear of hospital and medicine, fear of complication after COVID. So that is the whole, in the 1 year, I could gather the information. Now, those who got affected by lockdown, staying at home, no outing, no social meeting, not able to meet family members, struggling for food, loss of business, fear of losing job, sedentary life rubrics. So rubrics for this state, helplessness, feeling of. Everyone was, according to me, myself, we were so helpless. Even the medical science, everyone was helpless. This was a state for, I think, for every human on this earth. At that time, everyone was feeling helpless. How to help the people? Even the people don't know how to help themselves. That was the first choice for me. The second rubric, delusion as if seized. Now, the word seize means everything stay, lockdown. No one could move. No one could go outside. No social gathering. So that is the second choice for me, delusion seized as if. Anguish when alone. So people were starting to feel so much anguish because they felt alone in the world, suddenly. Anxiety when alone. That was my 4th rubric. And when you see repertorization, only phosphorus is the remedy. So it was very quick for me to know from the mental state. That was the 2nd stage. Those who got infected, especially old or patient living alone, means COVID wasn't a problem, but due to it, living alone and managing life alone was the most disturbing factor for many patients. So there was a rubric I chose, delusion, that she's alone in the world. So we have few remedies: camphor, cyclamen, hura, platina, and pulsatilla. Next set of rubrics. The other more depressive feeling was no one is there to help them in the dying situation. And even if they die, then no one will be there to take them for cremation. Delusion alone, she's alone in the graveyard. Sepia and Lepi. When I asked people why do they want preventive medicine, then I was told that they are afraid that corona may take away their energy, job, family, or it will eat up all their resources. Fear of consumption. That was another rubric with few remedies. So when I clubbed these 2 rubrics, fear of consumption and delusion alone in the graveyard, only 1 remedy, sepia. Next set of rubrics, anxiety about business, fortune reversal of aggravation. This was the major key rubric. People were feeling that whatever they have planned in the life, whatever their fortune they thought is gone. So only 2 remedies, calcarea carb and rustox. If we club 2 rubrics, anxiety business and fortune reversal, 2 medicine, calcarea and rustox. Next set of rubrics, those who stuck at home, no physical activities, exercise, work from home. I have the rubric anxiety from sedentary employment, arsenic and graphite. Business talks of. And when I clubbed these two rubrics, arsenic was the only remedy. So I was prescribing arsenic, but if the people say that we feel that nothing is there now for their life. Next set of rubric, fear position to lose is lucrative. That was the one of the rubric in youngsters or the people who have on the high post. They were calling me and they were fearing that they will lose their jobs and they don't know what will they do in the future. It is herself. Another good rubric because everybody was pitying, oh, what we are in a very bad situation. So if I club these two rubric, Calcaria and Staphylococci. Next set of rubrics, people were sad, angry, no traveling, staying all time home, no social interaction, no friendly meetings. Amusement desire was increased. Travel desire too. And when I club these two rubric, amusement desire and travel legacies. Travel desire too. Insanity with desire to travel. I have many examples where the people become so insane, we call in India rage or like a traveling for repulsive traveling. And two medicine, tuberculinum and belladonna. If I take these two rubric, travel desire to insanity with desire to travel. Tuberculinum and belladonna. Next set of rubric, people were asking to do something for them, pleading to God and doctors. Carry desire to be praying. And when I club these two rubrics, veratrum, arsenic, pulsatilla, belladonna, and rustox. Next set of rubrics, people were ready to take all kind of measures in order to escape from corona or to get better. Praying loudly means their voice should reach to the God or doctors in hospital, shrieking 8-4 and praying loud in sadness. And when I club, only platina. Next set of rubrics, many people suffered from mild to severe depression as they lost hope while in hospital or staying in isolation after getting affected. Disconcerted, despair, lost, think everything is. Mood repulsive, very strong rubric. Irritability, pain during, and only ignitia. Next set of rubrics, there are two also patients who were hopeful, positive, high-spirited, means they are living with positive attitude that nothing will happen to them. They don't want to wear mask. High-spirited, indifference to suffering, only opium. Hopeful, positiveness. In the last is vaccination, preference or no preference. So there are people who are, not preferring due to their own myth, view, opinion. But if a person call and said, doctor, if I can take vaccination, but due to fear that it may cause harm to me in future, or there are those who need to take vaccination for job, else they lose their job or to save their family, children, they want vaccination but are not sure what to do. Fear of suffering, anxiety about his family. So the most frequent medicine prescribed by me, jalcemium, 48 cases, 40 cured, belladonna, 62 cases, 55 cured, stramonium, 31 cases, 27 cured, hyoscyamus, 28, 26 cured, ignitia, 17, 9 cured, pulsatilla, 30, 26, phosphorus, 22, 20 cured, platina, 8 cured, opium, 14, 11 cured, nux vomica, 23, 18, arsenic 32 cases, 23 cured, and CPR 13, 8, lycopodium 16, 11, veratrum album 2 cases, 2 cured, acetic acid 6, 4 cured. So potency, in all cases got 3 potency in the beginning, and as per their condition, potency enhanced up to CM. So every case got 3 potency. So conclusion. From my clinical studies, I have come to the conclusion that it is quick and easier to help patients suffering from any illness if we could understand their exact mental state from how and what they say about the illness and apply mind rupees accordingly. Thank you very much.
Thank you, sir, for this nice presentation. This gives us a different approach for treating COVID-19 patients. As there are no questions in the question answer box, I would request respected chairs to please give their valuable comments and suggestions.
Dr. Hoover?
Yeah, I'll go ahead, take a stab. So it's an interesting approach, certainly opposite of what I think the mainstream would be doing from a homeopathic perspective in terms of most people would be approaching the physical pathology and the symptoms related to that, those symptoms that are borne out by the virus itself. So I'm just wondering, when you were measuring these patients for cure, how did you decide when a case was cured or not cured?
Okay. The first thing is that as I was prescribing the medicine on the mentality base, so for me, the yardstick is that when the patient calls me back, I would inquire that, are you still worried? If you still are in a panic state? And the patient would respond to me that, doctor, after taking the medicine in 24 hours, I'm relaxed. Even though I'm suffering from cough, I have fever, but I'm very relaxed. I'm not worrying about my job. I could sleep very well. I could eat very well. My appetite has come back. My taste has improved. And after 3 or 4 days, naturally, they got improved without any further medication. Only one time medication was given in 3 potency. All the cases were given in the beginning 3 potency, and then 6 and up to CM if needed.
Got it. Okay, that was my only question. Very nice presentation.
Okay.
Thank you.
Thank you, Dr. Sehgal, for your presentation, which of course opens a new area for treatment. Homeopathy is unique because it considers the mental sphere to a great extent, both the conscious and the subconscious mind, and that is the uniqueness in homeopathy. Now, coming to this pandemic, of course, it had a lot of fear, it had a lot of depression, it had a lot of anxiety, fear of death, fear of disease. And arsenic album, which became the main remedy, was because of this mentality. A lot of fear, depression, given up feeling, and anxiety, weakness were covered all with arsenic. But arsenic became the main remedy both as a prophylactic and curative because of its mentality. Thank you.
But I just say that I prefer to prescribe with individuality rather than going with the.
Yes, of course.
So I was interviewing the patient as per their need. For example, I gave arsenic. If arsenic was, I felt that person is arsenic, I have given arsenic. I have no reservation about this.
I fully agree with this. But
Thank
why
you.
arsenic became such a common and important remedy? It was because of the mentality.
Yes. Thank you.
Thank you, Chairs. Thank you, Dr. Yogesh. As per the schedule, our next presentation is by Dr. Martin Brands from Netherlands, but as we can see, he has not joined. So we'll move on to our next presentation. Our next speaker is Dr. Ludmila Asukina from Russia. She is affiliated to Center for Homeopathic Medicine Vital Force, a Russian homeopathic society. And the title of our presentation is Possibilities of Classical Homeopathy Administered to Patients Infected with New Coronavirus Infection Having Cutaneous Manifestation. Over to you, Dr. Asukina.
My report on possibilities of classical homeopathy in the management of patients with new coronavirus infection who have skin manifestations. According to available statistics, skin manifestations of the disease are observed in the range from 0.2% to 20.3% of the patients with the new coronavirus infection, COVID-19. The analysis and assessment of the nature of skin manifestations in patients with COVID-19 promotes learning of the pathogenetic mechanisms of the new coronavirus infection, improving the quality of diagnostic and therapeutic approaches. The objective of the work is...
excuse me, ma'am, please move your slides. You're still on the first slide. Please move your slide. You need to move your slide, ma'am.
My slide?
Yeah, you're still on the first slide.
Yes.
Please move on to the next one.
Yes.
Yeah.
Yes. Sorry. The objective of the work is studying and classification of skin manifestations.
And you can take it to the presentation mode.
What do you say?
You can take it to the presentation mode.
Presentation mode.
Yeah.
Yes.
It's on the right lower corner of the screen.
Do you see my presentation? Do you
Yeah,
see
we
my
can
presentation?
see. Yeah, we can see, but the slides are not moving. You need to move your slide.
Don't slide there.
Yeah.
This? No?
You need to go on to the second slide. Can someone from the
I
technical
move
team
slide.
please
I
help?
move slide. What do you see? You can see my slide. Ну-ка, посмотри.
Yeah, we can see your first slide. First slide.
Давай. Сейчас, wait a minute. Давай так, другой. Вот,
Yeah, it's okay, ma'am. Yeah.
Хорошо, так. Мы же не вошли, настройка слайда. У меня все вот так. Да. Ага.
It's okay.
It's okay. Thank you.
Yeah.
Да. Yes, the objective of the work is studying in classification of skin manifestations in patients with COVID-19, assessment of their pathogenetic mechanisms, correlation with the severity of the disease, type of therapy, and prognostic value, homeopathic assessment of the nature of rashes, taking into account the patient's health level, constitutional and miasmatic components of the patients is a new approach to this problem. Single center prospective cohort study was carried out from April to May 2020. This study was performed following the stroke guideline. The final sample size consisted of 58 patients. 2.1% of overall patients among 52.7% with dermatological consultation having the diagnosis of COVID-19. The data obtained are observed in approximately 2% with COVID-19 represented by 7 different clinical types, each of which demonstrates different pathological patterns. Currently, interim guidelines, prevention, diagnosis, and treatment of a new coronavirus infection, COVID-19, have been approved in Russia, version 13.1, November 2021. Approached by the Ministry of Health of Russia, which are almost identical with the above data. According to interim guidelines, the following types of skin rashes are distinguished in COVID-19. The analysis of the available clinical data, domestic and foreign sources, was carried out regarding the nature of skin manifestations in patients with a confirmed diagnosis of COVID-19. Skin manifestations, patient with COVID-19, group 1, skin angiitis, clinical picture, erythematous purple spots on plaques, mainly affected feet or to a less extent hands. Symptoms of pain, burning as well as itching have usually been reported. Erythema, multiform, exudative, vasculitis of finger and toes. Special forms associated with COVID-19 include acrovasculitis of limb, which is caused by concomitant hypoxia, pseudo-frostbite. Histopathological findings, perivascular and periadnexial dermal lymphocytes infiltrates. Group 2, papillosquamous eruption and ink lesion represent characteristic infectious allergic skin lesions, also often associated with COVID-19. The clinical feature of pink lesion is absence of material plaque. Group 3, measles-like eruption and infectious erythema, clinical feature, generalized symmetrical lesion starting from the trunk with the centrifugal progression. Papillary lesion may coexist from the onset of development during the course of the skin eruption. Histopathological, superficial perivascular lymphocytic and or neutrophilic infiltrate, COVID-19 severity, light, intermediate severity. Group 4, papular vesicular eruption. Clinical features, widespread polymorphic pattern consisting of small papules, vesicles, and pustules of different sizes. A localized pattern consisting of papular vesicles lesion, usually involving the mid-chest, upper abdominal region, or the back. Histopathological findings, prominent acantholysis and diskeratosis associated with anucular interepidermal vesicles in a suprabasal location, COVID-19 severity, intermediate severity. Group 5, Coccidia, not directly related to coronavirus infection and other result of individual intolerance to certain patient medicine. Group 6, urticaria, clinical feature, itching, urticarial rash predominantly involving the trunk and lips. Angioedema may also rarely appear as the pathological finding. Papular interface dermatitis associated with superficial perivascular lymphocyte infiltrate, COVID-19 severity, intermediate severity. And group 7, artificial lesions, trophic changes in facial tissues due to prolonged stay of the patient in the prone position. Generalization, all clinical experience and results. The results are based on my experience in homeopathic management of patients with skin disease. When I came to homeopathy about 30 years ago, I had been a dermatologist with a scientific degree. Presented all clinical observation and homeopathic experience in managing 15 patients with COVID-19 with dermatological syndrome, data for last years, including 2 children and 13 adults aged from 3 to 68, mild severity, 4 patients, medium severity, 9, and severe severity, 2 patients. Skin manifestation are polymorphic, so far example, skin angiitis, patient's man, 50 years old, miasm, psora, and psychosis.
Sorry to interrupt you, ma'am. Ma'am, your voice is very low right now. Just speak a bit louder, that's it. Or keep the mic little closer.
And now you hear me?
Yes, ma'am. We can hear you now. Thank you so much.
Now it's better?
Yes, ma'am.
Yes, thank you. Patient, woman, 55 years old, miasm, psora, and psychosis. Erythema, patient, child, 4 years old, psora. Measles-like eruption and infectious erythema, papular squamous eruption. Patient, woman, 50 years old, psychosis and syphilis before treatment. And the next, before treatment, and after treatment, after 3 months. After treatment, after 3 months. 4, papular vesicular eruption, patient, woman, 38 years old, psora and syphilis. Urticaria, patient, man, 54 years old, psora. Miasmatic case analysis. 1, determination of the miasmatic status of the patient, dominant miasm and latent miasm. 2nd, miasmatic structure of the remedy. The 3rd, miasmatic affiliation of the symptom. At the same time, the miasmatic status of skin disease is studied deeply and thoroughly. The 3 miasmatic nature of the disease can be traced in each element of the disease in accordance with Samuel Kahneman's miasmatic conception. For example, according to the authors' opinion, Gupta Manchanda, 2019, urticaria, SORA, 3, psychosis, 2, syphilis, 2. According in this way, it's possible to analyze the miasmatic component of each homeopathic remedy. Miasmatic structure of the remedy according to Banerjee. The nature of skin rashes is the result of the interaction of an excitatory trigger factor, COVID-19 virus, on the person and the constitutional miasmatic status of the patient. Skin rashes in COVID are considered as a result of an exciting SORA. They do not require special treatment. Sometimes they do not require special treatment and pass within a few days. However, in some cases, in severe cases, the nature of these rashes clearly indicates a pathological process in the body and contributes to the correct choice of a homeopathy remedy. In conclusion, I want to demonstrate two cases of severe severity of the disease. Case 1, patient woman, 50 years old, syphilitic, atypical COVID-19 septic condition of unknown genesis opera. Before treatment, homeopathy remedy, Pyrogenium 200, Crotalus horridus 13,200 after treatment. Case 2, patient child, 5 years old, SORA and syphilis, tubercular, immune thrombocytic opera. Complaints, rash, ecchymosis on the body, anamnesis of the disease, delivered to the hospital for emergency indications. According to mother, from the 2nd February, ecchymosis appeared on the legs, nasal bleeding once. The 3rd February noticed the appearance of a small hemorrhagic rash with a tendency to increase throughout the body. In January, the child suffered from viral disease. Platelets was 10,000. The team took him to the department, medical department. Status upon admission, objective status, general condition, moderate severity, the condition of the skin, visible mucous membranes, lymph nodes, skin color, pale pink, rash, on the skin of upper and lower extremities, buttocks, trunk, abdominal, petechial, and purpurous rash. Ecchymosis on the lower, isolated hemorrhages on the mucous membranes of the oral cavity. Conclusion, the patient was sent to hematology department. Homeopathic remedy, phosphorus, tuberculinum 200 sulfur, LMHI. In November 2021, platelets are normal. The use of the data obtained indicates the possibility of analyzing skin manifestations among COVID-positive patients for the timely diagnosis of the disease. As part of the homeopathic approach, skin manifestations in patients with coronavirus infection should be considered as a result of the effect of an exciting factor coronavirus on the constitutional and miasmatic soil of a sick person. The results of all clinical practice of homeopathic management and support of patient with a new coronavirus infection with skin manifestation indicate the effectiveness of the homeopathic method both in relation to the underlying disease and its dermatological syndrome. Thank you very much.
Thank you, ma'am, for your presentation. Very few studies have been conducted in the field of dermatology with respect to COVID-19. Thank you, ma'am. Now I request chairs for their to please give their suggestions and valuable comments.
Thank you, Dr. Osakina, for your very valuable paper, information, unique because we don't have much work done on this field. But this is what makes homeopathy unique. This is what makes homeopathy very different in the field of medicine. So skin or mind or anything, we have just to achieve the individuality. And skin is one organ which is very helpful in achieving the individuality. Many patients, especially long COVID patients, are suffering from skin manifestations which started during the acute episode and continued and still continuing. And this is a big problem. And we have many medicines for that. Thank you very much for your study. And also from here, we can really do some more work. I think this work should be given more to the research people for further investigation. And this will, I think, bring more results and more knowledgeable inputs for us. Thank you very much.
Thank you.
Yes, thank you, Dr. Ludmila. I had one question that came to mind. It's clear that the ITP, which is often associated with viral infections as an autoimmune problem that follows, do you have an estimate of what percentage of dermatology problems come from conventional treatment causing the rash, the therapy causing, just due to the patient being at bed rest or on ventilator causing the skin condition, or a manifestation of the coronavirus disease itself? Like, how does it break out? Out of 100 patients, is it 50% it's due to the virus, or is it 50% it's due to the medicine, the conventional treatments? Do you have any idea just from seeing the cases?
I see my patients, 15 patients with white and skin manifestation. This patient, my patient, give treatment for me and two from this group before all the early stage of COVID, обращались, go to hospital.
So their skin.
After hospital, what the young man with severe immune thrombocytopenia, and the woman, and another, and not big percent of patients with COVID have or dermatological signs, not big, and many of them, if the state of patients are not severe, the patients have a psora condition and maybe psora psychosis condition. This patient, they no go to doctor with skin eruption, and the skin eruption not need special treatment. And severe cases, it's more difficult.
Got it. Okay, thank you.
And for my mind, the type of rash is corresponding according to the miasm status, very severe, to the miasm status patient, only miasm status. And if eruption discount recovery in psora patient and in psychosis and syphilitic patient, the next remedy may be with not only acute condition, but with touch the chronic condition.
Got it. So
Dr. Osakina, a very small suggestion in your study, you can categorize these patients into two broad groups. Number one, patients who already had chronic skin infections and then they got viral infection with COVID-19, and how did the skin behave? Secondly, patients who never had any dermatological history or skin disease, but they were acutely infected with COVID-19 and then they developed skin rashes. Just broadly divide into two and then move further. I think then you will get still more better information.
Well, thank you. I agree with you, and this question is very interesting. And in the future, we are planning to continue analysis in this aspect.
Thank you.
Right. May I request our moderator to please invite the next speaker?
Yeah.
Yes,
Pascal is ready for the presentation.
Yeah.
thank you. I will
Yeah,
put on
thank
the
you.
video.
Yeah, I now invite Dr. Martin Brands, an independent researcher from Netherlands. The title of his presentation is Observation Multi-Center Study of COVID Patients Treated in 2020 and 2021 with Homeopathic Remedies. Over to you, sir.
Yeah, okay. Thank you very much for having me here tonight. And I'm very glad that we can share our work and meet as if we were together in a nice conference room in New Delhi. But it's now the case that I just slipped away from the dinner which I had with my friends at home. So I'm glad to join you now. I will I'll share my screen.
Yeah.
My screen now?
Yeah, yes, sir. It's visible. Yeah.
Okay. Well, what we have done is in cooperation with the American Institute for Homeopathy, we have made an observational study to record the efforts to treat COVID with homeopathy. It started in 2020 and continued in this year. And then we decided to summarize the results. Actually, it may be that there will be a follow-up study when more cases have streamed in. I did this together with Peter Gold, the coordinator of the American Institute of Homeopathy, and with Corine Buschhoeter, which is a colleague from the center where I worked until my retirement in Amsterdam. Just a moment. Yeah, we want to see what can we create an evidence-based for COVID treatment and also to facilitate future therapeutics. So we have both looked at the results and we have looked at the diagnostic possibilities of analyzing so many patients. We collected some more than 300 patients and we collected the data in Excel spreadsheet. The provision of the data was done by a multitude of practitioners from America, India, and Europe. We performed a frequency analysis of the remedies used, and we also made an overview of the symptoms in the sample. And thereafter, we did a cluster analysis, and a cluster analysis helps to assess the symptom patterns. It's like clustering several data together to see what we could do with that. For the final analysis were included 210 patients. They were either tested by immune or PCR tests, or they were clinically confirmed cases when the tests were not done, which was especially in the beginning period of the study. But we determined a cutoff value of a minimum of 3 main COVID symptoms that should be present in each patient. These COVID patient symptoms have been presented in other clinical reports and studies elsewhere. The case definition was divided in respiratory, general, and localized symptoms. And while these symptoms, I think, are well known, the cough and the type of cough, the throat, the dyspnea, pneumonia, and then the chills, fever, myalgia, and fatigue, and headache, loss of taste, smell, and diarrhea. And also mental symptoms were used when they were needed for the qualitative selection of the remedy, but they have not been included in the quantitative analysis later. We included all COVID test confirmed cases plus cases where the criteria was met at least 3 out of the 6 main COVID symptoms. So then you have to think of the main symptoms here. We defined from that group, we defined cough, dyspnea, chills, headache, sore throat, and fever. The subgroup of this group was 61 people. So together we had a final number of eligible patients of 269. The outcome was the number of hours between the start of the treatment and the onset of the main symptoms improvement, as reported by patients and assessed by their treating doctors. Unfortunately, we have no sufficient data whether the specific criteria were met. So the improvement was mentioned subjectively by the patient and was also assessed by the doctors in terms of general clinical improvement with disappearance of the main symptoms. But due to the diverse provision of data for many practitioners, it hasn't been possible to put them into a discipline of respecting the exact clinical criteria for improvement. So we found a good reaction, but as there are no sharp criteria for define what is improvement, we are not displaying these results. We will make a further analysis of this before we publish this as an article, but I'm not sure yet if we'll arrive at that. What we did was making a cluster analysis. We wanted to define from the population, which you see here on your left hand, which means all the symptoms in the sample of patients. And then we cluster simultaneous symptom prevalence in subgroup of patients. And a subgroup is those who match the pattern of a specific remedy. So there might be a group which matches, for example, bryonia or gelsemium or natrum mur. And we have collected the people who fitted into those patterns after they had been treated. The data processing was making a cross table for the remedies and the frequency of use in improved patients. This was combined with the main COVID symptoms in the patients they helped to improve. And from there, we could distill the patterns of symptoms in patients that reacted with a favorable outcome to specific remedies. The cluster analysis deals with distinguishing groups of patients which had a specific pattern of symptoms which matched certain remedies. And those patients are considered clusters, as I showed you in this drawing. The symptoms form in each case a pattern, and they are mathematically combined through the cluster. The software we used for this was called R, which you can watch on this website. The R package is a group of software, and this specific type was used for cluster analysis, but they also provide programs for other purposes. What are the results? First of all, the frequency analysis of the used remedies provided both bryonia, gelsemium, phosphorus, and arsenicum album, which is not so astonishable because we know this from other case series and studies that these have been used and mainly used. But the cluster analysis assisted in one step further, which are the patterns of symptoms in the patients who improved to these remedies. So from this population shares, and you see these three numbers, this one, that one, and that one together form one. the number 1. So these are grossly.
So you may continue. Thank you.
Yes. Okay. I think I don't know when we lost contact, so I go back one slide. So what the cluster analysis helped us with to distinguish the patterns of symptoms in the patients who improved to these remedies. So the next step was to make an analysis of the prevalence in this group of these symptoms. For example, this group had a high number of people with fever and a high number of people with cough, dyspnea, and chest discomfort. So this was this group, and then the second group had these symptoms as highly prevalent. Oh, I have. Okay, do you hear me now?
Sir,
Yes.
we can hear
Yes,
you.
do you hear me? Yeah?
Yes, sir, we can hear you.
Okay, good. So the different symptoms were linked to the different clusters. So cluster 2 had these symptoms in a high prevalence, and cluster 3 had these ones. And if you look at these clusters, which came through to group-wise analysis, they correspond indeed to the 3 main remedies which have been used. And in this way, it was a confirmation of the literature as we know from the Materia Medica. So the symptom patterns from these population shares, these 3 groups, they emerge as corresponding to the key symptoms from bryonia, gelseem, and phosphorus. Arsenicum did not emerge from the cluster analysis, although it was one of the 4 mostly used remedies. So what's the relationship between the patterns and those found in the literature? Is that the clusters had their symptoms, and they were known from previous studies and the Materia Medica to discriminate between these remedy patterns in simultaneous presence. So the symptom patterns in this form of cluster analysis suggest their usefulness in differentiating between these remedy categories for future treatment of COVID, and that could help people who have limited amount of time and maybe also a limited amount of expertise in homeopathy to rely on these clusters of symptoms. When they see such a cluster in a patient, they may prescribe with more confidence that particular remedy, even if they have not made a very analysis very much in depth. So it's kind of a treatment for endemic and epidemic situations, which now gets an evidence base. There were some limitations in this study. The von Bunninghausen division in the specific symptoms was not applied by most of the practitioners, so we had to extract these symptoms from the data per patient. This may form a source of error in the precise reporting, so we did not include the specific sensations, modalities, concomitants, and etiology in the cluster analysis. Maybe as a new effort, we could make this with a group of practitioners who is capable and willing to make these distinctions. Because with these specific differences in hand between the subgroups, we can define more precisely, okay, this is indeed someone who corresponds to bryonia. For example, when the cough responds to certain modalities or the headache or whatever, then it may be better, more precise to link this symptom to the bryonia picture. Another limitation was that the ORIDL, which is the outcome score of the impact on daily life was not frequently recorded, so we could not include this as a secondary outcome. But we recommend its use in registration, the effects, especially when we want to know the general well-being as a low score, which may predict a slow recovery and long COVID effects. But that should follow from a new study, if this is really a correlation between a low score on the Oridal and development of long COVID. We cannot say that on the basis of these data. The testing, as I said, not all patients were tested with PCR on antibodies in the first months because it wasn't available yet in the USA. But we have found a solution partially to distinguish them on the clinical symptom grounds. Also, the PCR itself is controversial, as reports mention that it cannot distinguish between common variations of corona-like viruses. Multiplex PCR test has been proposed by the CDC, but it hasn't been implemented yet in monitoring the COVID pandemic, unfortunately. What's the relevance of these results for practice? Because the recording of the symptoms in the materia medica from the provings is not exact, and we have used the acute state of patients to compare with the acute remedy pictures mentioned in the materia medica. But we have to know, as we all know, that the remedy pictures contain acute and longer term reactions. So it may be that the difference between acute and the chronic states could describe in a sequence from acute to chronic symptom patterns a process-oriented materia medica description, instead of presenting the materia medica picture of a remedy as a cross-sectional analysis of a subject's reaction. Because we lose, in this way of presenting, we lose the dimension of time, and time is an important factor in the development of disease, as we all know. This absence has also led to a large interpatient variation within the provings, and the provings did not differentiate between the separate experimental subject or patients. So these subgroups of patterns within one remedy picture have not yet been made, which is relevant when medicine is moving towards a more personalized approach. And homeopathy could take a lead here, provides it make a subgroup analysis of its treasure. And that's what we have tried to do here with the cluster analysis, to make a subgroup analysis. As far as I know, the only large data of experimental symptoms arranged with reference to the experimental person, the prover subject, is the one of Allen, the Encyclopedia of Materia Medica. There in the text you can read the letters and the numbers of the different provers. So we could make extractions and try to see what are all the symptoms coming from the different provers, and from there we could maybe shed a light on this process development. So the link between a symptom pattern and a remedy is still hazardous, because we don't know whether these symptoms were from an acute or a chronic reaction. So we recommend cluster analysis as a tool to confirm in improved cases the patterns of symptoms of the remedy used effectively. Because what we have done now, and what came down to these three remedies, could, with a larger group of people, also be done for more remedies, and we could also see whether we could confirm these patterns as well. So first of all, this method may be useful in discriminating remedies in an endemic and epidemic diagnosis, clinical practice, and it could also help our future research in new recorded case series and systematic studies. And that's where I want to end.
Thank you, sir. Thank you for the informative presentation. You have elaborated upon one of the lesser explored areas in homeopathy, that is data processing. Now I would request the chairs to for their suggestions and comments.
Yes.
Hi there, Dr. Prince. This is
Yes.
Todd Hoover. Good to see
Yes.
you. I've been familiar with this study as it's been processing, although I'm currently retired, so I'm not seeing patients. I didn't get to contribute.
Yes.
I had a couple of quick questions. Did you analyze any severity subsets? In other words, did you
Yep.
find any patterns where patients with a higher degree of illness were found predominantly in bryonia or found predominantly in arsenicum album, et cetera?
You posed a question which I did myself, and we were not able, from the data which we received, and during the process it was not possible to steer the practitioners in that direction, to make a scale for severity of illness, which is also difficult because in one person who have a magnificent cough may feel less ill than someone who has a slight cough. So that is something. The severity of illness is always very difficult, but it would also be on my agenda to make an scale so we can group patients into these subsets, because I totally agree with you. Yeah.
Wonderful. Yeah, you missed, I think you missed the talk by Dr. Goda, who talked about barefoot medicine and training village
Yes.
experts, not experts, they were people
Yes.
trained in several rubrics, essentially, and prescribing to a tribal population using something similar to what you're describing, which is a quick and dirty look at the main remedies, so that could be translated to the layperson.
Yes.
And then
Yes.
my only other comment is you're kind of sounding the gong for the need for a well-trained practice-based research network within the homeopathic community that would make your work a lot easier if we had people who are used to doing this kind of research.
Well, you know, we have discussed this. I have had many discussions with Peter Gold also about this, and I must say there were moments that I got a bit desperate of the quality of the data. But on the other hand, I'm very happy that with so many nationalities, with different schools as their background, and so that we managed to group all these data together. I think in itself it's a nice example of international cooperation in homeopathy, and I wish we should do these things much more, because technically it's not so difficult. And it's strange that the COVID, may I say, hysteria has moved society, has shocked society so much that people are willing to do things which before weren't possible, like having a Zoom conference with 4,000 delegates.
Right.
So I hope in the future people will be motivated to do these kind of things, because I'm absolutely certain that that our let's say primary care position would be much stronger if we would focus on research in primary care homeopathy, because that's close to people's families, for people's homes, gives a lot of confidence.
Yes.
Yeah. Thank you.
So thank you for your work on this. Very nice.
Thank you.
Thank you,
A
sir.
pleasure.
Thank you. So moving on, and I now invite Dr. Pradeep Kumar Gupta. He is the principal and chairman of Neminath Homeopathic Medical College, Hospital and Research Center, Agra, India. The title of his presentation is Experience of Treating COVID positive patients in designated hospitals during first and second wave. Welcome, sir. Over to you.
Good evening to everyone. I hope that I'm audible and
yes, sir. Yes,
yeah,
sir, you're audible.
thank you.
Yeah.
So please share the screen so I can start with.
Yes, sir, it's visible. Yeah.
It's the hospital where these studies were conducted, and this is the campus of the hospital. And this hospital is the NABH accredited, the first NABH accredited hospital of India. These are the equipments and wards and some glimpses of patients. And we were the first medical institution of homeopathy, I think, all over the world, who got the permission for do the COVID research and the quarantine center. We started 200 bed quarantine center first. Thereafter, our research were clinical trial were registered with CTRMI. And this was the actual phase in first wave. We were all wearing the PP and gloves and whatever the gadgets were there. And very soon we don't use that in the second wave. I was the principal investigator for this, and Ritu Gupta and Saurabh Kumar were the co-investigators, and allopathy investigator was Dr. Dheeraj Kela, internal medicine, and Sanjeev Anand, assistant professor in Department of Pulmonology. And this was research were technical collaboration with the Center Council of Research of Homeopathy in India, and the coordinator was Dr. Anil Khurana, DG, CCRH, and Dr. Devdatta Nayak, Research Officer, CCR in New Delhi. The inclusion criteria was hospitalized symptomatic patient with COVID-19, age between 10 to 80, willing to give signed written informed consent. Sample size was 50%, institute duration was 2 months. And we started two groups, and first group was given medicine and another group by placebo. And this trial, out of 28, 25 patients were all right by bryonia within 4 days, and 2 patients by arsenicum and 1 patient by gelsemium. So this is the graphical representation. And bryonia was 89% cases, arsenicum in 7% cases, and gelsemium 3% cases. The most vital study we started and during second wave, the period belonging to 5th April to 30th June this year. This was a phase was in our hospital patient for 87 days, and this trial was conducted exclusively in Neminath Homeopathy Medical College Hospital and Research Center, Agra, a designated COVID hospital in India. In these 87 days, we received the 12,254 OPD cases and 312 IPD cases, total 12,566 cases. So the OPD cases were 97.5%, and the IPD, those need admission for the patients, only 2.48%. So it's a lesser total in all the studies where only 2.5, less than 2.5% patient require the admission need for admission. In this study, out of 12,566, 7,769 were the male and 4,707 were the female. So this was the results. They recovered within 7 days were 11,009 patients, roughly 89.8, 90% patients recovered within 7 days, and within 14 days, 1,135 patients, 9% patient was need to take longer time, and only 110 patients, less than 1%, were not improved within two weeks. The remedies were prescribed of bryonia in 8,285 cases, 65%. Initially, bryonia was 90%, the first wave. In the second wave, bryonia was indicated in 65% cases. And arsenicum album initially was in 7% cases, now in 22, almost 23% cases. So prescription of arsenicum album was made to the 2,888 cases. And Hiperself, which was not indicated in first wave, was useful in second wave. 631 patients received, roughly 5%. Also, the Entimtard required for 258 patients, 2%. And some other remedies like arnica, phosphorus, gelsemium were given to 504 patients, 4% cases. So here, Brania is also the winner, but not at the extent in the first wave. I would say some data of my IPD. The period was same and total admission was 312 in 87 days. Average stay in the hospital was only 6 days, with the shortest stay in all the kind of medication noted so far. Out of 312 cases, which were 2.48% of total cases, we cured 295 patients, 94.5% cases. 6 patients died, so the mortality rate was less than 2%. So minimum in the all kind of treatment in India and the all over the world, as far as I know. And few patients were not willing to take the treatment. There were 11, and they were referred to the higher centers for further treatment. So this referral was also less than 4%. In short, we cured admitted patient 94.5% cases. And in IPD also a different scenario occurred. In OPD, Brania was the 65% cases required, but in IPD it was required only in 36 cases. And arsenicum by the winner here, almost 50% cases were cured by arsenicum. Total 156 patients were made cured by arsenicum album. And Hiperself here the same as in OPD, 5.7% cases. Total cases were cured 18. And Entimtard prescription was meant for 11 and 3.52, and others were 12. So other remedies were the arnica montana, phosphorus, gelsemium, and in one case camphor. So this was 3.84%. So this is in a video of a old man who came to my hospital. So I want to show that his oxygen saturation was 60 at this point. So a very critical patient. SpO2 was 60% and pulse was 105. Severe breathing distress last 15 days, unable to walk, congestion in chest, cough dry, was sick, and few days taking allopathic medicines, fever for 20 days. HRCT score was 21 out of 25. So the all parameter, it was a very severe case. And my prescription was arsenicum LM1, 1 globule mixed in 100 ml water, and 10 downward strokes, and 5 ml at 5 minute interval, and just see what happened after few doses of it. It was a CT score of the patient. The score was 21, severe case. Now, just after medication, what are the change within a very short span of time? Only in 40 minutes. So the patient was immediately responded to the arsenic album, and from 60 saturation became 81 within 40 minutes. And pulse became now 42, from 105 to it became 42. And patient was very much relaxed without any oxygen support or CPAP. The same medicine was continued for further. And the evening in the same day at bedside.
Sorry to interrupt you, sir, but we are running out of time. So can we please sum it up in next few minutes?
So it was maintained throughout the evening, and the next day patient is so happy. And I am not going to play the video due to the time constraint. And arsenicum LM2 was prescribed. It is also here. SpO2 became 86%, and pulse was absolutely normal. And arsenicum LM2 was prescribed again. And here the day 5 he is absolutely fine, and I made him discharge on day 5. So this is the discharge. So the attendant are saying that at the time of admission, the patient was having 60% saturation, now 92, and being discharged. So the same medicine, LM2, the doctor can have a strong impact on the patient than any drug. So our master has shown the moral remedy in aphorism 17. I would show a case. She was very much sick. Her saturation was less than 50, and she was on continuous oxygen. And I got to know that she is today is her birthday. So this was an almost gone case for us, and we tried here, as our master says in aphorism 17 footnote, moral remedy. So we, on the support of that moral remedy, the patient was survived. You look after a week, and we make him discharge. I will not play the video due to the shortage of time. I also another case of moral, what a doctor can do. This is a serious patient. The gentleman was not able to walk and stand even. And I said, I kept you on the corridor for fresh air. So I lift him in my hands, and you look, in the first wave, we all were wearing the mask and PPE, and second wave, we never use mask, PPE and gloves, nothing else, because we got the medicine, that is brandy and arsenicum, for prophylaxis. So this is a wonderful example of me and my team that homeopathy can work wonderfully, and we don't fear. So he also became discharged within a week. Not going to play the video. And where the art of medicine is loved, there is also a love of humanity. This is a dictum of Hippocrates. So these were the angels who were loving each and every patient. The Matra Shakti of great India, they almost all Rasaski created 95% cases from the death. And this was the entire team for this COVID.
Sir,
Thank you
may
very
I request you to please
Thank you very
conclude
much.
this? Thank you. Thank you, sir.
Thanks a lot, sir. Thank you. And we all know that Dr. Gupta and his hospital have been doing an excellent work throughout the pandemic, specifically highlighting, showcasing the efforts of homeopathy in COVID-19. Thank you. Thanks a lot, sir.
Thank you.
Since we don't have any questions in the question answer box, I'll request the chair to kindly enlighten us further about this session, about this presentation.
So thank you very much, Dr. Gupta. You know, I was struck by the images of the staff. You know, in the US where I am, most of the hospital workers are extremely stressed and fatigued by the COVID crisis and have been unable to find any relief. Many people are quitting their work because it's very depressing because so many people are dying. To see your staff there feeling happy and there's some special medicine there beyond the homeopathy that's working, and your staff is being taken care of in the process. So I was very struck by that. I think in the future, when you present the data, it may be helpful to add some comparative data of what's happening in conventional medicine to paint the picture more fully. You mentioned 2% mortality, which by itself, it sounds good, but when I just did a quick look at the Centers for Disease Control in the US, the same time period, the in-hospital mortality was running 10%. So you were doing 5 times better than what they were doing, spending, you know, many more millions of dollars on patient care than what you're doing. So it's a wonderful testament to the benefit of homeopathy. So thank you.
Thank you, sir. Due to the time constraint, I didn't keep all the data because only 10 minutes were allotted. So my request to the LMHI that if there is something noticeable, they should spare more time. Thank you very much. Thank you. Thank you.
Thank you, sir. I would now invite Dr. Maxim Teslov, affiliated to Medical Center Arena, Russia. The title of his presentation is Classical Homeopathy in the Complex Treatment of COVID-19 Infection. Welcome you, sir. Over to you. Screen is visible.
Hello, dear chairman and dear colleagues. Theme of my presentation is classical homeopathy in complex treatment of COVID-19 infection. Introduction. At present, the treatment of new coronavirus infection is carried out according to protocols written by World Health Organization. This recommends are limited to use antibacterial drugs, hormonal inhibitors of interleukin-6. These drugs have a large number of side effects, and at the same time can only prevent life-threatening complication. Etiatropic for SARS-CoV-2 coronavirus does not currently exist. The purpose of my study was to determine efficiency of classical homeopathy is an alternative to the official recommends and to make my own version of the treatment pattern with the inclusion of the most effective drugs. Materials and methods. Preparation of classical homeopathy, device for electropuncture diagnostic, X-ray diagnostic complex, computed tomography, and laboratory test results. A total of 415 patients with COVID-19 were treated during the pandemic. Mild forms 202 patients, medium forms CT1 to 198 patients, severe forms 15 patients, hospitalized 6 patients, mortality was 0.7%. Treatment with only homeopathy 253 patients. Homeopathy is combination with other drugs, 162 patients. The 150 patients with different form of COVID-19 were treated only with allopathy. In experimental group, recovery of medium form, pneumonia CT1 or 2 occurred on average after 3 weeks. In control group, after 6 weeks. After recovery, patients in the experimental group rated their level of health higher than is in the control group. They regressed symptoms such as weakness, shortness of breath, and headache more quickly. Most effective anti-COVID homeopathic drugs was in the beginning of disease Arsenicum album, Eupatorium perfoliatum, Chininum arsenicosum. In the height of disease Veratrum album, Phosphorus bryonia, Helidonium, Rus toxicodendron, Gilzimium, Tuberculinum. In a phase of temperature decrease, if pneumonia did not dissolve, sulfur. For dry persistent cough, Calcarea carbonica, Calcarea phosphorica, Lycopodium, Citraria islandica. In severe cases, Antimonium tartaricum, Carba vegetabilis, Gepar-sulfur, Mercurius solubilis, Pyragenium. In a case of the lung fibrosis, Silicea, shortness of breath, Kalium carbonicum, Carbaneum oxygenizatum, Ozonium. Case 1, patient 87 years old. He became ill after contact with his grandson who suffered from pneumonia. Temperature was higher, 40 degrees. It's followed by shortness of breath, cough with a yellow expectoration, a feeling of intense heat, desire of fresh air, asks to open window, perspiration and thirst were absent. Pulse rate 120 beats in minute. Auscultation indicated wet wheezing in the lower part of the lungs. PCR test was positive. He had concomitant diseases, arterial hypertension, coronary heart disease, and hip fracture. X-ray examination of lungs shows summary injury 35%. Prescription sequence was Pyragenium, Kalium carbonicum, Carba vegetabilis, Tuberculinum, Sulfur, Chininum arsenicosum, Phosphorus, Arsenicum album, Calcarea carbonica, Lycopodium, Chelidonium, and Silicea. Every remedy only one dose. After 20 days, the condition is satisfactory. No complaints. Control radiography after 2 weeks shows decrease of pneumonia to 15%. After 5 weeks, pneumonia completely dissolved. Case 2. Patient K, 41 years old, complaining of increase in temperature, 39 degrees, feeling of euphoria, muscle pain, dryness in eyes. After taking paracetamol, the temperature decreased, and on the skin have appeared eruptions like urticaria. He felt pain in the skin, shortness of breath, loss of smell and taste, hoarseness of voice, and profuse perspiration. At night, were added. PCR test was positive. CT scans of the lungs showed 25% of injury. Blood analysis increase in white blood cells, neutrophil shift, increase in thrombocytes, increase in alanine aminotransferase level of procalcitonin was low. Electropuncture diagnostic showed changes in the meridians of the lungs, lymphatic system, spleen, gallbladder, and kidneys. Vega test diagnosis shows health level 1-3 on the Vitulka scale, good adaptation reserve, photon index 8, high cellular immunity intensity, intox-3 intoxication, high viral load, coronavirus, human immunodeficit virus, and malaria. Acute inflammation of lungs. Homeopathic prescription sequence was Eupatorium, Perfoliatum, Chininum arsenicosum, Arsenicum album, Phosphorus, Pulsatilla, Tuberculinum, Sulfur, Calcarea carbonica, Lycopodium, Chelidonium, Silicea. Each remedy in only one dose. After 3 weeks, control CT of lungs shows that pneumonia totally dissolved. Conclusions. Classical homeopathy showed better results in the treatment of new coronavirus infection than the use of only standard protocols of the World Health Organization in the term of recovery. And treatment of COVID-19, it is necessary to use not one homeopathic sequence, not one homeopathic drug, by the sequence of prescriptions due to multi-organ injury and rapid dynamics of symptoms. In the treatment of COVID-19 infection, especially in the case of pneumonia, it is necessary to use Nazot tuberculinum as well and antipsoric remedy sulfur. Homeopathy offers an individual approach and makes possible to success treatment of elderly patients with the presence of concomitant diseases. Electropuncture and Vega test diagnostic can be used for the initial diagnosis of COVID-19 and for rapid monitoring of changes in the patient's condition. Thank you for your attention.
Thank you, sir, for your presentation. I request the chairs to please enlighten us further in this regard.
Thank you. Thank you for this very informative talk. I'm sorry I was offline because of some technical problem, so I missed quite a lot of the sessions. Uh, I was halfway during the last session, and I must congratulate our Russian colleague that he has been working. This type of study is the need of the hour. We work with homeopathy, the single dose, the classical method, and we also monitor it with the markers and the pathological uh, tests. So it is very important that we share our results not only with symptomatic improvements but also with the pathologicals like D dimer, in which direction we are moving, or the inflammatory markers like serum ferritin and CRP. So it is very important for us, or IL-6, to know where we are heading. And we can also impress upon our colleagues in the other school of medicine, look, this is the result of homeopathic remedy. So I think this type of study is very important and should be shared all over. Thank you, doctor.
Thank you very much. Thank you.
I just had a couple comments. Tremendous amount of work that you've done. I appreciate the severity of cases that you've been seeing and the complexity of things. It's very nice that you've documented it with the X-ray finding and the objective findings, which are often missing in many cases that I read. I have a caution on the conclusions. While it's clear that in your group of the experimental group, there was a 3-week recovery versus 6-week recovery time in the conventional group, unless the cases are matched carefully to look for confounders or differences within the populations, drawing specific conclusions, we have to be a little careful with that. It looks like there's a clear difference, and you can say it appears that there's a difference, but you can't conclude that there's a difference unless those further pieces of information are provided. The other thing I found interesting was your finding that tuberculinum and sulfur are needed for pneumonia. And I would say it's interesting information. There are other presenters, such as Andre Sain, who have presented cases of COVID pneumonia that didn't require tuberculinum and sulfur. So I'm not sure that that conclusion is 100% consistent across the board. So again, you could say in our experience, tuberculinum and sulfur are very helpful or useful, but to conclude that they're necessary might not be accurate. So we have to be a little bit careful about how we language things. But otherwise, great work. I really appreciate the efforts that you are putting in to treat these kinds of patients. Thank you.
Thank you.
Thank you, chairs. Thank you, Dr. Maxon. Moving on, we have Professor Shripad Hegde. He is the director of Tattva Homeopathic Research Center, Bangalore. And the title of his presentation is Qualitative Research on Treatment of COVID-19 Patients with Homeopathy. Over to you, sir. Yeah, your screen is visible, sir.
Good wishes. I wish you all a good health. It is the needed at the COVID pandemic time now.
Thank you, sir.
And this is qualitative research study of COVID-19 patients with homeopathy. These are all the different varieties of photos. See, the acute respiratory syndrome due to coronavirus, as you know, the SARS-CoV-2 is a novel infectious disease which has quickly developed into a pandemic. The expression of a COVID-19 symptoms are broad, ranging from mild to moderate respiratory tract infection to severe progressive pneumonia, multi-organ failure, and death. There are multiple studies and clinical trials to treat or cure the coronavirus infection. During first and second wave of COVID-19 pandemic, many patients are treated with homeopathy successfully. Where, you know, the first wave, where many places we are not allowed to even see the patients or treat the patients, and we get a good opportunity during the second wave of COVID-19. And the COVID-19 encompasses varied clinical spectrum. During the incubation period, almost average 2 weeks, the patients are either asymptomatic or present with mild upper respiratory symptoms in 2 to 4 days after being infected. The symptoms include sneezing, coughing, running nose, fatigue, sore throat, and fever. And it was, all you are aware that we are not allowed to see patients, or either we are afraid and patients are also afraid to come to the clinic or a hospital. And a very important feature which raises the suspicion of COVID-19 is dyspnea, which is seen in over 65% of patients and may take 2 to 9 days to develop after the initial exposure to the virus. The most common clinical symptoms, the fever was around 86%, cough was around 63.9%, malaise and fatigue around 34.7%, and shortness of breath somewhere around 19.7%, and the productive cough around 28 to 29%, and myalgia 18%. Only few patients present with gastrointestinal symptoms like diarrhea around 5.7%, and nausea and vomiting around 6%. In 26.7% of COVID-19 patients, there was at least one underlying comorbidity like hypertension, diabetes, or chronic cardiovascular disease, or a pulmonary disease like a chronic bronchial asthma or COPD, such sort of diseases, or the renal disorders, or like a malignant disease. The severe form is characterized by acute respiratory distress syndrome that necessitates mechanical ventilatory support in an intensive care unit, and also leads to multi-organ involvement resulting in shock, septicemia, and multiple organ dysfunction syndrome with high mortality. COVID-19 patients also have increased risk of thromboembolism, including disseminated intravascular coagulation. See, I think everybody, you are aware throughout the world, the situation was so like that. Even doctors, we felt that we are of no use. There was a situation of hopelessness and helplessness. The situation was so like that. Patients were also panic, doctors were panic, and even the health authorities, including WHO, they were all the panic. What is to be done? What is not to be done? There was a lot of chaos was there. And during that time, what you see, the anxiety, fear, uncertainty, and isolation from everybody and everything, and depression, which leads to that, or the very severity, the hospitalization, oxygen demand, or intensive care unit care, or erratic behavior of the virus as well as patients, which made everybody to worry. And I feel even still today, many patients might have died because of the fear and the disease both together, and death of a near and dear by hearing the things and hearing the news, the media. So many have got their own role to create the havoc during the first and second wave of COVID-19. And see, this is for the clinical purpose. For my understanding, we made the prodromal phase like acute rhinitis, cold, and catarrh, sneezing, and all. Entry phase was acute tracheobronchitis or throat irritation, and serious phase, the acute respiratory distress syndrome like pneumonia and liver injury, cardiac injury, secondary infections, or a kidney injury, or a septic shock. And source and method, I have treated many cases during second wave. First wave, hardly you could able to hear the stories. And I made the classification in two categories. COVID patients treated with only the homeopathy, who had mild to moderate manifestations, and COVID patients treated along with the allopathic medicines, who were actually having very severe manifestations and complications, where they were admitted in hospital or either in emergency ward or in ICU or with oxygen supply or with the many other supplements which has been given to that, and many casualties have taken place. But in this research study, out of many cases treated, taken 30 patients with the mild to moderate COVID-19 infections during the second wave of pandemic in Bangalore, where I practice and I stay in India. They were treated successfully with homeopathy. All these were diagnosed with RT-PCR as well as essential other investigations like a blood test as well as X-ray or the CT scanning and all. And so these many patients at the different age groups. I think the chart is very visible where the medicines have been used, like arsenic, carbovagin, calicarb, and even the Blata mother tincture have been used. Like this, the 15 patients' history is here. Different remedies have been used: bryonia, arsenicide, entimtart, aconite, bryonia, belladonna, heparsulf, arsenic, carbovage, and tuberculinum. Earlier, the doctor was mentioning that in belladonna, heparsulf, bryonia, and in one or two cases where without medicine, because earlier where arsenic has been given as a immune booster, where the patient they did not require any medicine, though their RT-PCR was positive. That was also an interesting thing where we have to keep a watch. And next, another 15 patients where the bryonia, hepar, and spongia, like these are the group of remedies have been used in the different age groups. You could able to see in this chart, we see the lowest age group is 16, but the maximum is 78 years old gentlemen. See, these are the things in our study where 17 males and 13 females. And these are the presentation of the symptoms in the different age, like a 27% fever and 24 cough and 10% cold, running nose and 10 breathing difficulty. And 6 is throat pain or irritation in the throat. 6% the body ache as well as headache, chest pain, vomiting, anxiety, the joint pains, and no complaints, but they were positive, maybe because of the exposure to the other patients. And this is the different the age group. And outcome of this treatment is almost 83.3% of the total 30 patients who were positive and symptomatic and treated homeopathically. Around 25 they got cured of symptoms, and around 5 they recovered. All recorded a negative RT-PCR at the end of the treatment. Even before the treatment, because it was a compulsory, wherever they come with a mild or a moderate or any symptoms or the signs of COVID-19, they have to undergo the investigations, and it's a must for them to RT-PCR test. And these are all the patients, the positive reports where in the marriage function, they got the infections, both husband and wife, and they have been treated. The where husband is treated with the aconite and bryonia, the wife was treated belladonna and heparsol. This became a negative, that is RT-PCR test, which has been conducted, and they were allowed to move to the different places because they wanted to go to the other country. That's why where they were in a hurry to move. But when they came here, they got the infection, and it was a tough job to see. This is another patient where have been treated. See, this patient actually, she is explaining that how whole family they got the infection, but she has been taken the actually arsenic alb as an immune booster, which was almost given by the almost all the homeopathic doctors as well as in the society. It has been distributed by the Ayush government of Karnataka as well as other voluntary organizations. And she has actually narrating the symptoms where you can hear.
I am Anusha Bhatt. I'm 24 years old. A month ago, me and my family were hit by COVID, and I was the last one to get affected by it. So whereas my family started showing symptoms, I was not. By consulting a doctor, Dr. Shripal Hegde, I did not take any medications, and as per his instructions, I followed a healthy lifestyle. Finally, after 15 days, I recovered from COVID and I tested negative. I thank him for his guidance and helping me get through this.
See, this is another patient's history. I think I have to run behind the time. See, there positive and negative reports are there with the very severe infections. You could able to see the CT chest of this lady. You could able to see the focal area of the airspace opacities, where core adds 3 indeterminates, and the very strong pneumonic changes were there. And this is the CT place where she recovered fully. And here she has been given where initially the arsenic alb and the bryonia alba, calicarb and carbovage, the blata, where in the severe cases we have to change oftenly depending on this is another patient. See, the another thing where interestingly I could able to see during that time, we are not or we are also afraid to see the patients, but by hearing their nature of cough, we could able to decide the remedies. This is one more thing where during this pandemic we learned so many new lessons. This also thing I think this. See, by hearing the nature of cough, we could able to decide the remedy. This is what our stalwarts like a Kent or the Boening and they explain the nature of cough. By hearing this, I could able to decide it was the pneumonia where initial phase was over and this patient has been given spongia. This is typically what is explained as per the Kent. There is another case where The patient's positive and negative things we could able to see. See, pulmonary findings are consistent with viral pneumonia, COVID-19 of mild grade. CT severity, lower score, 5 out of 25, CORAD 5, typical features of COVID-19 infections. Some of the cases where we have seen, though the RT-PCR negative, but in their CT scan or the chest X-ray, we could able to find the lesions. That's why I said it was a very panic situation to identify whom to be treated or not to be treated. This is the X-ray which has been taken. This is a patient explaining. I think it is showing time up. In this is a study, it emphasizes the rapidity of response among moderate to severe affected patients to homeopathic treatment when conventional medical options could not do much benefit. Survival of the fittest was the situation during bad COVID-19 pandemic. During this crucial time, by improving the immunity of the patient, helping the host to fight infections, homeopathic remedies did wonder in treating the COVID-19. So, as a supplementary, complementary, as an individual homeopathic treatment, we have helped many patients. Thank you very much for patient hearing.
Yeah, thank you, sir, for a very informative and encouraging this presentation. Now I request the chairs for their valuable comments and suggestions.
So nice work. This is essentially a small observational study from your own practice, which is great and kind of goes to what Dr. Brand was talking about, the need for individual practitioners to look at their work and see what they're doing. I'm struck by the concordance of information, Dr. Kozlov's information, as well as what came out of the AIH and from Dr. Brand and different places where the remedies in different places, different practitioners, different methods of application of homeopathy all seem to come up with the same list of medicines for the most part, despite being in different parts of the world.
Naturally, at the different parts of the country, even in India itself, only we have seen the different places, we have given the different remedies. It's very difficult to make it.
That proves to see the individuality of homeopathy. Means individualization is the general which we need to follow.
Yes.
In different areas.
Well, thank you.
Thank you, Dr. Hegde, for your very informative presentation. And I feel that it's a very hard work. It's a clinical work. And because the time here in this colloquium or in any conference is so short that you cannot really present all what you want to. And there are also not so many discussions. So I think you need more time, you need a better publication for your work, and all these works should be combined to give it a footage. But I feel personally that in today's world, it is very important to support your work with clinical documentation, as Dr. Todd Hoover said. And all of us who worked in COVID acute phase, I think we worked a lot with prodromal symptoms. Even before the patient was found to be positively infected with COVID, with our symptomatic remedies, we still did the work before. So we prevented many COVID patients getting into really COVID positive by giving simple remedies like bryonia, gelsimum, aconite, or belladonna. Because we were ready with our symptoms. We didn't have to wait for the laboratory report. And if you go to the study of virology, the principles of virology, you find so much of homeopathic principles in them. The reactivity, the susceptibility, the immunity. The words so common in the field of immunology and virology are all from homeopathy. And we always talk about the individual, the host. And virus can never survive without a living host. A virus can never multiply without a living cell. So if the living cell is receptive, weak, virus will thrive. If the living cell is strong, virus will not thrive. And this is what our remedies do at this level of susceptibility. So we have prevented many COVID cases many potential COVID cases before they became positive with our remedies with common cold-like symptoms.
Yeah,
Which
yeah.
were potential for a positive COVID later.
Showing hope that we could able to do better for them.
Yeah,
They were confident.
yeah. Yes, and also in very serious acutely infected patients who were hospitalized, we could support, we could use our remedies as an add-on support or as a complementary.
Yeah, Dr. Parekh sir, you are right, because even that's what I said. My another study is there where I did a lot of work on that, where patients were admitted. They were in ICU, they were with the support of oxygen, all that things. There some casualties also taken place, but there we could not able to get the proper data because they were already there. And some of the hospitals, they don't permit. In seeking, hiding, we have to give our medicine. There are a lot of problems were there. We have struggled a lot to give them medicines. I think
We appreciate
experience. Yeah.
We appreciate the other systems of medicine, what positive they do, and it should always be complementary.
Yeah. You are right.
Yes, and
some of the hospitals, they have permitted. No. You also try along with us, because however we want to see the benefit of the patients. Our human service is more important, not the system. But some persons, they were not allowed. Yeah, you are right.
And so in many desperate cases, all of my learned colleagues, the team of moderators here are also very senior homeopaths from our country, Dr. Jethani and Mrs. Jethani. I feel that in India, we worked so much, right, starting from the villages where there was no education. In cities, the patients were so educated with the clinical parameters that they would come to a homeopath and say, "Doctor, my IL-6 is high. What do you have in homeopathy? Doctor, my D-dimer is high. What do you have something in
They come with
homeopathy?"
the investigations.
Yes. So immediately, if they come to me with D-dimer high, I would know, okay, it's something to do with clotting and something to do with the blood vessels, flow of the blood. And you ask some more symptoms, and there you are.
There was a common question they were asking, the CT scan. Sir, I have done already CT scan. They used to send through the WhatsApp their reports. No, this is all how the panic situation has created. You are right. But
And
only
with due respect, may I request our seniors and all the dignitaries, we are 15 minutes ahead of our schedule. So now we need to sum it up. So I will also request our moderators to please conclude the session. Thank you.
Yeah, but we have one more speaker. We still have one.
1 second.
Yeah.
I've received the message.
Dr. Mark from Spain. We have one more.
Dr. Martin has joined?
Yeah, he has, yes.
Okay, so what I'll do is we can continue with this talk and I'll inform on the other group that we are continuing the session.
Yeah, please.
This was going to be the last one.
Yeah, yes.
Okay, so can we quickly introduce him, please?
Yeah, please. Yeah. Now I welcome Dr. Mark Zuis Clepers Vidal from Spain. The title of his presentation is Experience Collecting and Sharing COVID-19 Cases Treated with Homeopathy Nationally and Internationally. Welcome you, sir. Over to you.
Loud and clear.
Okay. Hello, everyone. Thank you so much for having me here. I'm very happy with all of my colleagues presenting all of these clinical cases that they are collecting and sharing. So I think it's very important. I will explain a little bit fast as we have short time. What I have been doing this last year and a half. So the background is clear. A lot of you have speak about it, but I had an experience with epidemic flu, studying genus epidemicus in my studies in homeopathy at the master. So the objective of at the beginning of this pandemic, I was certain that it was to collect and study COVID-19 cases treated with homeopathy that we all have in our on our consultations. So I'm gonna explain a little bit the three different projects I have been working with. The first one is the one from our region for LMHB, is Academia Médica Homeopática from Barcelona. So this project was the first one. Another one was Clifical that you all maybe know about. And the other one is the clinical case report from the La Liga. So from Barcelona, we started a collection of COVID cases. The objective was clear, was to characterize the epidemic disease and to postulate the genus epidemic for our colleagues. And to do that, we collect all the cases through a checklist of symptoms, similar from what Dr. Frey is using in their studies. One of the example of these questionnaires with this checklist that we use is this one. This was the first questionnaire that we give the patient or the doctor the first day, the day one, it was a better way or easy way to separate the modalities, the amelioration, aggravation, and all the symptoms. Also, we give the patient another secondary checklist in the at the 10th or 14th day of the first consultation to see the follow-up, or maybe earlier if it was needed. So all the results of this study, we collected more than 100 cases, 103 mild and moderate cases. They are presented in a public, in a paper from Homeopathy Journal that I share with you here. So the symptoms that were more intense or more frequent and also singular and had the clinical picture of these patients were fever at night, coldness sensation, aversion to uncovering, thirstlessness, mild cough, dyspnea, and thoracic constriction at night, only internal dryness sensation in the air passages, also anxiety at night, fear of suffocation during sleep also, an extreme weakness, desire to lay down. There was an intense modality of worse talking, and also the loss of smell and taste that every one of you have shared in the previous cases. Also, this was our results from the first 103 cases, but only 88 of these cases had a complete follow-up. This was to check the prescribed remedies and also to have some information about which remedies had more effective. The most prescribed remedies were bryonia, arsenicum, phosphorus, calcemium, and camphora, but this was the frequency of prescription, but the effectiveness was with more than 4 cases for each. It was sulfur, pulsatilla, bryonia alba, belladonna, phosphorus, and arsenicum above 50% of rate. And the better effectiveness was with 200 C potencies. Our recommendation was to use bryonia, phosphorus, sulfur, camphora, and pulsatilla. And we share it with an internal newsletter and also with webinars in Spain and also in India that we were invited. Also, in my experience using Clifical COVID-19 support project, it's a project coordinated by Carlo Rezzani, as you know, and it tries to collect COVID-19 cases through a simplified and structured cases and a platform. And we use like data, epidemiological data, clinical, and also test data. And the follow-ups are from 1 to 14 days at least. And it's really easy to manage data with these kind of programs. And nowadays, it has more than 1,000 cases collected. And the results at the moment, for example, for our cases from Spain, there are 53 cases, 100% with the test positive. And the remedies more used are a little bit different from those from worldwide, from other places, and our remedies were Bryonia, Nux vomica, pulsatile, and sulfur. Also, the other project I have been working in, it's Liga Medico-Homeopática Internacionales COVID-19 clinical case report. It's the one coordinated by Robert Van Hasselen. And it's a different kind of collection of clinical cases, more with a scope in quality. Those cases are collected through the care guidelines, the home case care guidelines. And also they have the Monarch inventory to classify the effectiveness, no, or to standardize the effectiveness of the treatment, of the homeopathic treatment, through the laws of healing, no, that we all know about. And it's a standardization of the clinical cases report that I think is really necessary. There's a submission form in a Word that it's really simple to use. And also it's structured like a scientific paper that also later you can share with the scientific community easily. My contribution to this project was, well, here I put just one example, the 41-year-old female with pneumonia COVID-19 that was completely cured with natrium mur 200C, and with a high score of 8, like the positiveness of the effect of the homeopathic remedy was really related. The cause effect was strong. And my conclusions for one and each of these projects that I have been working on is that our project from Barcelona was really easy to start and to analyze data. We could give colleagues a clear clinical picture of the epidemic in just 1 month through articles, newsletter, and webinars. But also the paper checklists made data collection and analysis difficult at the end of the study. Also, Glyphicol, it's a really easy to use platform. It takes only 5 to 10 minutes per case to be done, but with little text and multiple options that you can fill in. It's a good program to manage big data collection, but also it's difficult to evaluate quality between cases. So this has to be, I think this has to be reviewed. And also there are so many differences between the results comparing, in my case, Spain and the other sides of the world. So there has to be a new tool to evaluate between those cases that we put it in this platform. And also for the clinical case report, the La Liga, I think it's standardized is key for sharing clinical cases report with all scientific community. Collecting all important data in this kind of project is really simple. It's easy to fulfill. It's well explained in the submission form, but also it has its disadvantages, as much as every case takes a minimum 2 hours to fill it properly. So at the very end, my overall conclusions, and I think those are important in regard of all the presentations of the doctors before me, is that we should promote collecting and sharing cases as we do. We should connect our daily practice experience with clinical research. It's important to create a new homeopathic knowledge ready to be shared with a scientific community. And also, I think, and this has to be discussed, but I think that we have to build an international platform better than the ones that we have to collect homeopathic clinical cases. And it has to be easy to use for everyone. It has to manage big data of the meaningful variables. And also it has to be standardized through home care case standards. But also it has to have some space for the subtle symptoms, no? Such as mind symptoms that some of the presentations talk about. And it has to be open, that I think that most of these projects are really close. We have to be able to see each other cases and to compare and to have our own conclusions of it. And I think the important thing about it is to unify quantity and quality, because some of these projects have a lot of quantity, like more than 1,000 cases, but lacks a little bit of quality that other projects that have a little bit impact have so much. So thank you very much.
Thank you, Dr. Mark. Thank you. Before we conclude with this session and have the keynote remarks by our chair, I would request all the panelists to kindly keep their video themselves in video mode, so that we can have a group photo session towards the end of the chair's comment. So now I request the chair to give comments not only regarding this presentation but also a synopsis of the entire session.
Thank you, Dr. Jethani. Very interesting session, and the session which concerns us all in the present time. Since we are very short of time, so I would not like to be much between the next session. My only submission is that collection of cases, increasing the data pool, making a big data collection is very important, and a methodology so many of speakers have suggested is very important. And so we need to have a standardization for presentation of clinical cases. And these clinical cases should be palatable to the medical scientific world of today. So they should be in the scientific words and scientific acceptance of today. This is very important, number one. Number two, the part that we didn't touch in our session was the long COVID, which is going to stay for a long time. And long COVID is one condition where homeopathy will have a lot to do and is already doing. So I think the session also had experiences in acute and long COVID, I think. And we didn't touch the long COVID aspect much, but long COVID had so many symptoms concerning the mind, the physical body, the organ pathology, and we have lots of medicines in homeopathy for that, and that will include the constitutional remedy, which we are not using in the acute state. That will also use the intercurrent nosode in between, and there we will have to remove the miasmatic blockage. The Sora miasm always flaring up, and these types of things are coming up in the long COVID, and homeopathy has something very special to do here. So with this, I thank everybody, the moderators, the coordinators, and all of them who are the speakers, and also my chair colleague, Dr. Todd Huber, and I would request him for his comments. Thank you very much. Thank you very much.
Great. Well, thank you. I have a couple comments also. It seems like the session was more cohesive than I imagined, in that what Dr. Vidal was pointing to and Dr. Brand before him was the need, and what Dr. Parikh just mentioned was the need for a practice-based research network. All of these studies with 30, 100, 1,000 patients, if we were able to combine them, we would easily create studies of 40,000 patients. But as Dr. Vidal is pointing out, we need an instrument that's easy to use, that doesn't take 2 hours to enter a case. We need real clarity on how symptoms are collected and identified so that quality can be assessed for the cases. We need a way to serially collect cases so we see failures as well as successes. We need some type of objective rating scales and objective findings and ways to enter that. We need the causality tools such as Monarch, which I actually was worked with Dr. Van Hazelaan for some time. And we need very clear outcome measures. One of the things that we miss mostly is not applying clear outcome measures. And that's something that's one of the first things as an allopathic doctor I look at and say, all right, well, how did you decide whether the patient got better or not? And in homeopathy, we often say, well, they got cured. So this is the most valuable and applicable way to assess homeopathy as individual cases. But we need to get better at finding the language of conventional medicine and applying it, especially in terms of outcome and causality. How do we know the medicine worked? And how do we know it was the medicine that did the trick rather than something else? So these things, I think, will definitely move homeopathy forward. And in some way we could collaborate and use some type of universal instrument, that would take us a long way in terms of demonstrating the effectiveness of homeopathy. So thank you again to everybody. The presentations were great. I appreciated all the diversity and interesting points of view. And I wish you all well.
Thank you, sir. Thank you, Dr. Todd. Thank you, Dr. Parikh. Thank you, all the speakers. But this program would be incomplete without expressing our gratefulness to the coordinators, specifically Dr. Radhika, Dr. Ritika, who have been working behind the scenes, and to Mr. Hime and Ms. Surbi, who have made sure that this program goes on relentlessly well. Thanks a lot. Thanks a lot for all your efforts. Now, I would request Mr. Hime to coordinate for a group photo of this session, please.